Kristen, if you, there you are, you're ahead of me there. Just to let you know that we will be recording this session and we will post this up on the BAC YouTube channel. So I would, my great pleasure to actually thank Sheri Scott for agreeing to present today on embedding sustainability in current lab practice. Sheri is a senior lecturer in Nottingham Trent University, and I know that she also has is going to introduce herself as well through in the presentation. So I'd like to hand you over now to Sheri, and thank you on behalf of the BAC.
Thank you very much, and I'm really pleased to be speaking on your behalf today. So I am a lecturer, and so in any presentation we like to give you some learning outcomes. So if you do wish to reflect about the session after today's presentation, what I'm aiming to achieve through the presentation is to help you understand the relationship between the climate emergency and public health. So really sort of showcase why it's important that we need to consider sustainability, help you understand the concepts of sustainability and sustainability quality improvement, and help you gain some knowledge of case examples of where you can embed sustainability into current laboratory practice. So just a little bit about who I am and where I come from. Well, I joined the profession in 1996 as a trainee biomedical scientist at Nottingham City Hospital, and I had a slightly different start to my career, as I started in a full-time degree course and then carried on my degree course part-time up at Sheffield Hallam University. I became HCPC registered in 2000, went back to Nottingham Trent to do an MSc, carried on my career up to a band 7, spending 14 years at Derby Hospital, and where I got involved in training and CPD, and finally as a band 7 at Queen Elizabeth Hospitals, Birmingham. And this was in a clinical biochemistry environment, so that's where my roots lie. But I welcome and appreciate all the other disciplines in biomedical science. And then in 2018, I got the opportunity to actually move from clinical laboratory practice into a practice-based lecturing role at Nottingham Trent University. As it's practice-based rather than research, we are expected and encouraged to retain our HCPC registration, maintain our professional development so that we can embed practice into our teaching, and also retain any links with our professional body. So I continue with roles as assessor and verifier with the Institute of Biomedical Science, and now that's evolving into a sustainability ambassador role. So my background, as I've mentioned, I've got that 21 years of lab experience working in clinical laboratories, and I'm a fellow of the IBMS, and I'm also a higher specialist diploma chief examiner. So what I try and do is link all those professional roles to foster professional development at all stages in a biomedical scientist career. And more recently, my professional role has started to embed sustainability and teach about sustainability. So I am a core member of the European Federation of Laboratory Medicine's Green Lab and Sustainable Taskforce. And I've also launched a couple of initiatives such as the Centres for Sustainable Healthcare Clinical Labs Susnet, which I'll talk a bit more as we go through the presentation. And as an Institute of Biomedical Science Sustainability Champion, I'm now going out and presenting on behalf of the IBMS and Nottingham Trent University to try and foster changes in practice. So that's my background. That's what I'm doing as my role. And as part of that, I really want to sort of launch student research projects on lab sustainability and work with organisations such as Greener NHS, the EFLM, the IBMS, and more recently we're looking into research with the Medical Research Council and the National Institute of Health to try and foster a clinical approach to lab sustainability. So why do this? Well, there is a really strong relationship between the climate emergency and public health. So as healthcare professionals, we have a responsibility linked to public health and promoting best practice. And sustainability is that balance between the environment, equity, and the economy. And in 2015, the United Nations developed these Sustainable Development Goals. These were 17 goals that aim to end poverty, protect the planet, and ensure prosperity for all. So these goals had specific targets that the UN were hoping that the World Commission and its collaborations could achieve these goals over the next 15 years. Now, some of these goals can resonate quite easily with sustainability practice within the NHS and other clinical laboratories, and others not quite so much. So what I want to do as I talk through this presentation is try and help where we can make a difference in relation to these sustainable goals. So it's well documented in that our changing climate is leading to more frequent heat waves. We're seeing extreme weather events in the news, whether that be flooding, such as in Auckland, New Zealand recently, whether it's droughts, an increase in the number of storms. But these increasing reported extremes are growing evidence of the health impacts of climate change. And that climate change and air pollution, as a result of these, we can see increased levels of heart disease, stroke, lung cancer, and an increased spread of infectious diseases, which all impacts on our workload and on our own health, as well as the health of our service users. So I've been undergoing some training with the Centres for Sustainable Health, working with key professions to try and highlight this climate crisis and try and link in these sustainability goals and current practice. So whether that's working for good health and well-being, SDG number 3, working towards quality education, or looking at life below water and life on land linked to climate action number 13, what we want to try and do is increase the education around these SDGs, these sustainability goals, and link to what we can do in our professional and our personal practice to help try and reduce these negative effects. So climate change is becoming more apparent. We are seeing it. So what we're seeing as that impact of that climate change is that increase in heat-related illnesses, increases in death and cardiovascular failure, through to increases in allergens that's resulting in respiratory allergies and asthma, infectious diseases such as cholera, Campylobacter, and algae blooms. And also we're seeing increases in malaria and dengue fever. And all of these will impact on our clinical laboratory practice. And it is being recognised because of these impacts that organisations are declaring health emergencies. So I've got a very quick video here that's been produced as a result of the Lancet Countdown Health and Climate Change report. And they produce a yearly report to look at climate change and how that affects health.
The health of everyone alive today is being threatened by a persistent fossil fuel addiction that is accelerating climate change and amplifying the harms of the simultaneous crises we face. As climate risks escalate, action to ensure a livable future can no longer be delayed. The Lancet Countdown brings together researchers from around the world to track the health impacts of climate change and the health benefits that will come with accelerated climate action. This year's report shows that all the impacts we monitor are rapidly worsening. Exposure to life-threatening extreme weather events is accelerating. Heat-related deaths among older people have increased by 68% over the past 20 years. Climate suitability for the spread of infectious diseases such as dengue and malaria is rising, and food security is being compromised, with more heat waves resulting in at least 98 million more people lacking access to adequate food than in previous decades. This is putting additional pressure on health systems as they continue to grapple with the devastation of the COVID-19 pandemic. Now, the over-reliance on fossil fuels leaves households vulnerable to the rising energy prices, and the slow adoption of renewables leaves millions exposed to dirty fuels in their homes. And while oil and gas giants are making record profits, a just, healthy transition is undercut by a lack of funding, and governments still allocate hundreds of billions of dollars to subsidizing fossil fuels. Regardless of claims and commitments, the strategies of the largest oil and gas companies would lead to emissions vastly exceeding levels compatible with a healthy future. It doesn't have to be this way. In our response to the concurrent crises, we have a new opportunity to prevent the worst climate change impacts and deliver a healthier, safer, and more equitable future. By redirecting efforts towards rapid and just climate action, people around the world could also feel immediate health benefits. Shifting away from fossil fuels could save 1.2 million lives annually from cleaner outdoor air. Greener, energy-efficient cities could benefit people's physical and mental health, and climate change adaptation could deliver more robust health systems, better prepared to cope with future infectious disease outbreaks and climate shocks. The time to act is now. Decision makers must take bold actions to deliver a low-carbon, resilient future where people around the world can not only survive, but thrive. Visit the Lancet Countdown online to find the latest assessment of the state of health and climate change in your country.
So there's really strong messages through that video. And what is the NHS doing in response to this climate emergency? Well, the NHS has to reduce its carbon emissions to net zero by 2040. The NHS is being urged to adopt this circular economy, which I will describe in a bit more detail in a moment. And its new research is showing that we need to work with our suppliers and adopt CE practices or risk for failing to meet those government carbon neutral pledges. So we need to understand about that NHS carbon footprint and the NHS carbon footprint plus, and linking to our supplier carbon footprint, so that we can then achieve these targets and able to improve our impact on the environment. There is an NHS Improvement Sustainable Development Management Plan that looks at the education and looks at employment. But there's also other projects such as the Greener NHS that is looking to actually specifically target the climate change by reducing our emissions to net zero. We've got other initiatives such as the Getting It Right First Time that also can aid in reduction of this carbon footprint. So how are we going to tackle climate change by reducing our emissions? Well, it'll be through our care, developing a framework to evaluate that carbon reduction, through our supply chains and our medicines, through our transport and travel, and through our hospitals. And it's where we can feed into the hospital side that potentially clinical labs can make a difference. So I mentioned this carbon footprint. Well, what is that carbon footprint?
A simple show explains the carbon footprint. This is you. You've probably been hearing a lot about climate change and how you should reduce your carbon footprint. But what is that exactly? Just like an actual footprint, it's a mark you leave upon the environment. No, not with your shoes, but with every action that releases carbons. Those are the harmful gases, such as CO2, which are pumped out by burning fossil fuels like oil and gas. The more fuel you use, the bigger your footprint will be. You may think that by driving your car, the only carbons you release come from the engine, but no. Consider the carbons that are emitted just to get fuel into the tank. From the energy needed to extract the oil from underground, the pollution caused by transportation and refinement, to the final delivery to your local petrol station. Not to mention the CO2 released by manufacturing your car in the first place. More than you thought, huh? So unless you live in a cave, you and everything you own has its own carbon footprint. Read a book, printing and distributing. It uses energy. Brush your teeth, and your utensils will have a history in a factory. Even
Sorry about
something
that.
as basic as an apple could have traveled hundreds or even thousands of polluting miles to end up in your local supermarket. You see, it's pretty much impossible to leave no carbon footprint behind, but that's no reason to stop trying. Think about your actions and choices, and you'll be able to reduce your personal mark after all. That's how you really put the boot into climate change.
That might be a little bit simplified, but what it does show you is that circular economy. So have you ever thought about what your carbon footprint is? And if you do want to have a go at this will help you understand very roughly what your current carbon footprint might be. You can use the QR code or the link, and that will then enable you to answer a few simple questions to be able to get a rough estimate of your carbon footprint for the last year. I'm just going to need to just turn mute on a second because I just need to check my settings because my battery is going to stop, so just bear with me. So hopefully you've got an idea now of that carbon footprint. So where is that carbon footprint coming from? Well, is that carbon footprint coming from travel? And we can think about, if you look at these slides from Centres for Sustainable Healthcare, about what would happen if we did nothing and where the NHS carbon footprint would be, but if also where we can target to reduce that carbon footprint. So we can look at national electricity decarbonisation, looking at healthy ways to produce that energy, renewable sources. We can look at maybe shifting to lower carbon inhalers within healthcare, looking at the nitrous oxide usage. But ultimately, we need to work in combination, looking at our travel, looking at our buildings, and looking at research and innovation and potentially offsetting that carbon. If we look at pathology and clinical laboratories, we can try and look at where that particular carbon is coming from, whether that's coming through energy that we produce as part of our lab practices, whether it's energy through our patient and visitor transport, for the whether that's for the patient to get to and take a clinical specimen, or whether it's the patient coming into the hospital, or whether it's that specimen coming into the lab. We can look at gases that we produce as part of our practice, and we can look at the waste that we use. And we can look at the carbon footprint of the travel and look at the ways that we travel. Is the transportation in our lab practice using the best forms or most lowest carbon forms of transport? What are the transport of our staff? What are the transport of our samples that we collect? Of our deliveries for the equipment and the kits that we use within our practice? And if we go on a meeting or if we go to a conference, do we travel by train or do we travel by flight or by car? And this is just one of the areas where we can use more sustainable methods of transport. And that links into our circular economy. We need to look at our manufacturing, our consumables, our reagents and logistics and waste, and try and foster that circular economy. It's not just about whether we recycle, but is there a way that we can recover parts from equipment that it no longer works? Can we refurbish that equipment? Can we look at the distribution of equipment that if it's no longer fit for purpose, could we redistribute it to perhaps universities or other locations that could reuse that equipment So even if something is no longer fit for purpose within our, from a quality perspective within the lab or to remain current, is there an alternative way that we may be able to sell those parts back to the manufacturer or suppliers to feed back in to promote that circular economy, to prevent that waste going to incineration or landfill? These slides have come from My Green Lab, which is a non-profit organisation that's promoting lab sustainability. Labs are resource-intensive spaces. They use 10 times more energy than offices. They use 4 times more water than offices. And we produce, not just in the clinical, but within research and academia, 5.5 million metric tonnes of plastic each year, which is equivalent to 12 billion pounds of plastic. So we use plastic. So how can we reduce our carbon footprint? And these key areas where we can link into those sustainable goals. We can look at the waste we produce and aim to reduce the plastics. We can look at our water consumption and move to greener chemistry. We can reduce the energy that we're using within our practice, and we can make sure that we consider health and well-being of our staff to try and promote those sustainable and reach those sustainable goals. Well, you might have heard about the 3 R's, the 4 R's, the 6 R's, or the 10 R's, but some of the key fundamentals is reduce what we use, recycle where we can, repair what we can. If rather than recycle, repair, can we reuse something, restore it? But ultimately, we need to think about the rethinking our practice and what we do. So let's have a look at some sustainable practices, whether that's reducing plastic in laboratories and thinking about what plastic we use, whether it's thinking about programs or changes to improve our lab efficiency, or whether it's promotions to promote staff wellbeing initiatives within our trusts, within our organisations. What we need to do is identify opportunities. It is hard to reconcile that circular economy with the healthcare sector. Single-use plastics are widely used and have hygiene benefits. And there are many single-use items that are favoured over reusable alternatives. But what we need to think about, is there somewhere where we can reduce that single-use plastic? Or if we can't, can we reduce the need for those single-use plastics? To making trust more sustainable, we need to adopt that circular economy model. And quite often, if we do that, we can actually create cost savings. We need to talk to our procurers and look at our tenders and consider, as part of the suppliers, what sustainable policies do they have? Do they have ways to promote less deliveries, for example? We've all been responsible for that urgent delivery that when we need something, but maybe we need to talk to local labs or local hospitals to maybe share resources and find something more locally if we need it urgently, and so that we are working together to reduce that need for that one delivery that maybe only have one item on it. Plastic has become ever present in healthcare supplies. So what can we do to try and limit that use of that plastic? So we need to talk to our procurers, we need to transform procurement practices, and when products cannot be safely reused or reprocessed and local waste management allows, think about how we recycle products or make them safe for recycling. These few slides are taken from the Royal College of Pathologists and can give us some fundamental steps that we can take, that we can apply to laboratory and office practices. Do we promote a paperless office or paperless lab where possible? Can we consider things like tablets in our audits rather than printing out that paper? Do we have a recycling of our general office or uncontaminated waste? Are there plastics that we get in our deliveries that we can potentially reuse or recycle or resend back? Do we incorporate copying, scanning and vaccine facilities and thus avoiding the need for additional machines? So do we share equipment? Do we, if we do have to photocopy or print, do we use both sides of the paper? Do we recycle our PCs at the end of their useful life? And do we make sure we utilise sleep modes or turning equipment off? If we have to have a meeting within the lab, do we encourage anyone that's having to travel from site to site to travel by public transport or use electric rechargeable modes of transport? Do we offer alternatives such as tele and video conferencing? And this is a great example via Zoom, where we've got nationally and internationally people coming to look at this presentation. Have we got ways of using motion sensitive lighting, low energy bulbs? And do we have labelling to promote turning off of equipment, computer screens and other equipment that doesn't necessarily need to be on for 24 hours? What can we do without any kitchen waste or waste that's not coming from our laboratory environments? Do we place food waste and non-recyclables in designated waste bins? Have we got links with local allotments for potential composting? Do we have dedicated bins for recycling? Do we use filtered tap water instead of bottled water? And if we have a on-site meeting, do we promote glass water bottles rather than plastic? And do we have a way of monitoring and actioning on leaks as and when they happen? And then there's 4 key symbols here that utilize simple ways that we can have a more sustainable impact by making sure at home we cook with heat with lids on. We've got layers rather than turning temperatures up on our household central heating, that we switch things off and we don't overfill. And relating back to that lab practice, what plastic and polystyrene reducing measures can we introduce? Do we have centralised ordering to promote bulk ordering with fewer shipments and reduced levels of packaging? Do we have recycling stations in laboratories that allow recycling of packaging as well as uncontaminated plastics? Or refillable tip boxes, for example? Have we identified practices that could be replaced with more sustainable approaches? Is it feasible and safe to use bioplastics within our practice or use gloves that have come from sustainable companies? And is there a possibility of decontaminating and autoclaving plastic tubes for their reuse in certain situations that won't impact on the quality of what our lab results? And if we take a closer look at energy and where that energy is coming from, it gives us an idea of assessing and walking around the lab and where we might be able to make changes. And it might be looking at our audit processes to adapt our audits to consider energy usage and equipment usage and plastic usage. And when we look at our freezers and our storage, do we use -80 or do we use -70? If we can change that practice of -80 to -70, we can change about 30% of the energy consumed from our freezers. If we're not sure about the integrity of our samples, then we can initiate student projects or projects related to registration to potentially look at this to maybe use evidence-based practice to inform that change from -70 to -80. And even if we can't make that change, do we maintain door seals? Do we defrost regularly? And do we have a regular clear out so that we're not storing unnecessary items or samples? And do we think about our water? Do we check whether we've got low flow aerators to reduce the water that comes out our taps? Have we got ways to run autoclaves or dishwashers so that they only run when they're full? And are we using the right quality of water for our tasks that we're performing? And the chemicals that we use, chemicals are a big issue which requires attention. And we can look at 2 particular chemicals such as formalin and xylene. Formalin has served as a routine tissue fixative for over 100 years, despite the fact it's got well-established human health risks. So are there safer alternatives? Well, lab protocols and workflows are optimized for using formalin fixed paraffin embedded material. But there is research out there to consider those alternatives. But the problem we face is whether long-term storage of tissue in alternative fixtures will yield the satisfactory tissue preservation that we desire. And so maybe we need some studies to consider this. And what formalin substitutes are there? Well, there's ethanol-based solutions that can be used, and other alternatives such as honey and natural sweeteners have been suggested. But also, if we can't change that formalin substitute, can we reduce the amount of formalin that we use? And some suggestions lie around vacuum packaging for samples to minimize that volume of formalin. But either way, we've got no alternative fixative that has gained wide acceptance. So further work and further considerations needed for this. If we look at xylene, xylene uses a clearing agent in routine histological tissue processing and staining. Again, the harmful effects are well recognised. But what alternatives are out there? And some of the alternatives are often found to be expensive, or give or have an odour that can give everyone a headache. So we have to think about alternative processing procedures. And again, research out there as one such alternative has been suggested by Michigan State University Veterinary Diagnostic Laboratory. And here is a quote by Professor Matti Kipau, who commented that he's quite proud that they have actually introduced a change of xylene free. And you can actually go on and have a look at this paper which discusses these alternatives. And you can have a read of the blog series by Charles River Laboratories that highlights new and creative science that's reported on virtual staining, or virtual staining of digitized whole slide images that may remove the chemicals from the equation entirely. So that we can have a look from examples from sustainability and veterinary pathology about what they do. And they are happy to share their ideas and examples that work, and perhaps these can then be introduced into our own pathology practice. I'm going to take now a look at some examples and organisations that are there to help you. So Centres for Sustainable Healthcare, they promote these principles of sustainable healthcare, and they look at the reduction and more sustainable practice through innovation and prevention. So they look at prevention, promoting the health and preventing disease by tackling the causes of illness and inequalities. They empower patients to take a greater role. They look at lean service delivery and streamline care systems to minimise wasteful activities. And they look at low carbon alternatives to prioritise treatment and technologies with a lower environmental impact. So they produce lots of training and guidance to help professionals that work in healthcare to consider some of those changes of practice. Well, if you think about the carbon footprint, and you need to have a think about, if we're going to make change, where that carbon footprint is coming from, whether it's the energy use on site, whether it's the release of gases, whether it's the travel, the medical equipment, the non-medical equipment, or the waste disposal. We can consider projects that maybe evaluate that energy production, that carbon footprint, and consider changes. We can look at some of the research that's already been undertaken on and the resources out there, and this is an example of the carbon footprint of pathology testing for blood sciences, where most of the CO2 emissions were associated with the sample collection side of that pathway, whereas emissions attributed to the lab reagents and the power usage were deemed to be much smaller. And this is where projects such as Getting It Right First Time and looking at education to reduce the error rate in laboratories can actually reduce the carbon emissions by reducing the need for a repeat sample, or even reducing the need for that sample in the first place if we look at unnecessary testing and why we are taking the samples that we do. We can look at this example from microbiology laboratories on what changes they make. So looking and sharing best practices. And we can look at their example where their study shows that the largest amount of CO2 emissions in their microbiology laboratory came from the consumables and personal commuting. So we can look about promoting days where we promote staff to walk, cycle, or use public transport. We can look at the way that we transport our samples and the way that we encourage our patients and our service users to have more environmentally friendly options. And there is work being undertaken by the GP liaison service at actually mapping the routes that our collection services follow and looking at how many samples are coming from those collection routes over the mileage and their modes of transport. We can look at this example about on dermatopathology green laboratory initiatives and looking what results they've had from their study. They looked at reagent recycling and reuse. They looked at paper product recycling, plastic recycling, electricity reduction, and actually then seeing that they actually had monetary savings as a result of putting those changes into practice. And here you can see their annual costs per year from actually making those changes. So not only did they have that positive environment impact, but they also saved their department money. And then you can look at this paper by Malero et al. From 2021 that guides you on key focuses for targets within your practice for sustainable clinical laboratories. Do we have policies of reuse? Do we have that on-site recycling of organic solvents? How can we reduce our solid waste? Do we have green purchasing policies and paperless policies? Can we reduce our energy and water? And it's about getting together, creating group conversations that we can start thinking about what we can tackle, where we can tackle, and what differences we can make. And we can look at our projects within. So quality improvement is fundamental to laboratory practice. But we can start considering SUS-QI in that quality improvement, incorporating sustainability. We can look at whether the outcomes for the patient and populations over that environmental, social and financial impacts, that triple bottom line. So it's that approach to improving healthcare in a holistic way, working with our clinicians to make changes in the patient pathway that will benefit practice. Looking at our projects and evaluating our quality improvement projects for whether they have a sustainable and environmental positive outcome. And the benefits of this is that you actually then start seeing non-carbon impacts. You start seeing the reduction in air pollution. You might have projects that can look at tackling deforestation or landscape degradation or loss of biodiversity. Is there space within your hospital, your trust, within your organisation that you might be able to increase green spaces or biodiversity? Can you introduce plant life and which will have a natural health and well-being benefit? Can we look at reducing our bioaccumulation and toxicity of the waste that we produce? And can we look at reducing our plastic pollution? Here is a really good example from Newcastle Hospital's NHS Foundation Trust, where they actually reduced the single-use plastics used in the transport of laboratory specimens. They highlighted the issue of the plastic bags that cost specimen reception approximately £5 per day. And they, when they looked at this, the specimen bags did not comply with the United Nations sample transport regulations, and the laboratory staff spent a significant amount of time removing those samples from the bags. So the aim of the project was to introduce a reusable specimen box into GP practice and hospital phlebotomy services to reduce the need of that single-use plastic. And those boxes were brought into practice. There was a large element of training at the front end, because a lot of the checks that the reception did now had to be done by the clinicians and the phlebotomists taking the sample. But the benefits included time saved in the unbagging of the samples, and that reduced the turnaround time, so it had a patient service user benefit because the results got back to the service user quicker. The samples were transported more securely, and it was more efficient, so that there was less risk of a sample being misplaced and needing a retake of that sample. And it actually had ongoing financial savings to the trust. So along with those trust climate emergency strategy benefits, it also saw those social benefits and monetary benefits as well. And what we can also consider, if we look at to consider that study by McAllister and the sample carbon footprint, is how we can reduce unnecessary tests and how we can utilize point of care to reduce plastic usage, water consumption and energy use. Point of care is not appropriate in all situations, but maybe there are some patient clinical pathways where it would reduce the need for the patient to travel, to have that sample taken, for that sample to be transported to the lab, and then the sample to be processed. So let's look at what's happening in research. Can any of these research and academic strategies be included into clinical laboratory practice? Do we have a way of switching off equipment or using timers if something is needed early Monday morning? Do we make sure we close fume hoods and turn equipment off? Is there a way that we can use frameworks or strategies such as laboratory efficiency assessment framework or My Green Lab certification to promote sustainable practice and shout about sustainable practice within our laboratories? And can we purchase more efficient modes of equipment and reduce our consumption? It's about working together to reach this sustainability goal number 17, the partnerships. And it's through that partnership that we will get collaborative change to really come into force. You can join My Green Lab's Freezer Challenge and have a look at whether you can actually quantify the amount of carbon dioxide that you can save by reducing your temperatures of your freezers. We can look at LEAF, that has now established a clinical laboratory efficiency framework for clinical laboratories as well as the research laboratories. We've got several pilots going out, and I'm working with Martin Farley on this, so you can get so we can have a way of looking at that best practice and looking about the initiatives that we can incorporate into our practice. We can look at other strategies by My Green Lab. Do our suppliers use the ACT label system that shows you their environmental impact? If you want more training, have you thought about joining up to the My Green Lab Ambassador Programme, where they've got free training sessions? Have we had a look at what other strategies these organisations have and what networks we can join? And as part of the My Green Lab Taskforce, we've actually produced some guidelines for clinical laboratories to tackle those key areas of water waste and chemical usage. And you can download those guidelines through the QR code. And you can have a look at how we're embedding training to key professionals within the professional bodies to try and foster producing more sustainable education. Have you considered incorporating a mini version of this talk within your induction? Do you have posters? Do you have champions within your laboratories to help promote greener and more sustainable practice? And if you are interested in clinical labs, have you considered joining the network through Centres for Sustainable Healthcare that we launched in June last year, which is an online space for clinical laboratory professionals and educators to share best practice, come together and talk about ideas. There's resources and ways we can foster collaboration to try and bring our practice and reduce that negative impact. And is there some good practice ideas that we can share? Have we considered the environmental ISO standards, for example? Have we considered cloud computing, AI technology? Have we considered holding any meetings virtually? And finally, have we considered our email practice? The average carbon footprint of an email is 0.3 grams of carbon. This is higher, however, if it's a long email that takes 10 minutes to write or 3 seconds to read. It's also higher if we use an attachment. So when we do write our email, let's think about our email practice. Let's send less unnecessary emails. Let's copy less people into those emails. Let's use links rather than attachments. Make sure we delete our emails so that we're not using up server space. And let's unsubscribe from any newsletters that we don't actually read. Let's start these conversations. Let's consider what we do. And let's ask the questions that need to be asked. Here are some of the resources I used. You're welcome to connect with me through those networks, but also I'm happy to answer any questions that anyone on the webinar might have. Thank you very much.
Hi, thanks, Sheri. That was a really interesting presentation there. I'm sure it's probably got a lot of people thinking there. I don't know, has anyone got any questions? If you want to pop that into the chat, that would be great. I suppose in the meantime, I just wonder, oh, actually we do have one here. We've got, do large centralized laboratories have a low carbon footprint when all factors are taken into account when compared with smaller local units?
It would be in an individual to individual basis without looking at what their equipment, what they're using, or their transportation. You would have to do a full carbon evaluation to be able to answer that question.
Okay, it's fine. Another one, just around the email that you mentioned there. There's just a query as how does that create carbon emission, carbon footprint? Is it electricity or the computer?
Yeah, partly is the fact that when you're using those using those devices, you've got the light energy and the electricity that the use in them, and also you've got the cloud power of when something's being sent and stored on the server. I am not an expert. I am just but on the individual of how that carbon. But if you also think about the equipment that we used and that circular economy, that equipment has to be manufactured, has to be delivered, so that all that gets factored in. Okay,
I suppose then that's the trade-off. I suppose when you're talking there about can we do more online meetings, etc., then we'd have to use those devices. But I suppose the trade-off there is that's less than travel. Say, for example, or heating a room that everyone's sat in, I suppose.
It's all about weighing it up, and so we've recently introduced tablets into our laboratories at the university, which means that we no longer have to print all our protocols every year. But whether the carbon produced from charging those tablets actually works out more than the printing process, you would have to consider the manufacture of the printer, the paper, the ink, the plastic used within the cartridge, and it's forever a balancing act that we never got the complete answer.
Yeah, I suppose they're probably reusable though, rather than paper being disposed of or thrown out, especially if you're in a lab and it's clinical waste then after a while, you know.
And it all boils down to whether where the energy for the electricity is coming from, whether it's coming from a renewable source or not.
Okay, I've got a long partly comment and partly I think there might be a question in there. I'll just read this to you, Sheri. So fantastic talk, thank you. Totally agree, we need to take responsibility of all these issues within our labs. as we ultimately have control over them to reduce carbon footprint. But in terms of big picture issue is continued dependence of fossil fuels, but in terms of big picture issue is continued dependence of fossil fuels. I'd like to ask all science and health professions also join campaigns advocating for ending out dependence on fossil fuels, e.g. joining local climate action groups such as Health for XR, Scientists for XR, Fossil Free London. I think my comment,
Yeah, and I think, as I say, it's doing what we can to reduce our own carbon footprints, thinking about our own practice. And again, and if, as I say, I would love myself to have solar panels on my own house, but quite often it boils down to what we can afford and what's available. And all we can do is, I think it's little things, everything helps. I'm a vegetarian. It's not everyone's choice of diet, but even if we were to have one vegetarian meal a week, a month, it's little things that start to help reduce that carbon reduction.
Yeah, my question was around coordination around this. From what you've presented, there's lots of kind of organizations involved in this, but is there any kind of higher level coordination, I suppose, within the NHS, across the NHS, or even from government, etc.?
So I'm working with David Wells of the IBMS, and we are having regular meetings with Greener NHS to try and get them to consider clinical laboratory sustainability, because although a lot of the hospitals have got green action plans, the lab side of things aren't often incorporated in that, because up until I think about a year ago, when I really started to champion for this, it wasn't even a consideration as part of, as we often see, we're the hidden workforce. And I think those conversations are happening. The ACB has now got a sustainability group. The EFLM are champion across their member organisations. And what we're trying to do through me and David is to try and get some key stakeholder meetings happening and try and bring those key people, including the scientific officer and people that might have a bit more clout, to recognise these problems and where we can fit in and possibly make changes. So it's happening slowly. We're trying to pull together and work together. And I think I'm trying to embed it in education through the university, and I'm not the only university that's doing that. The different organisations are starting to highlight the importance of this, and it's just a slow process. And I think we can all just do our little bit in the meantime before we can make the bigger changes more nationally.
Absolutely, that's great. So I have a query here. Do you have an example of sustainable policy in a lab? You mentioned some NHS frameworks.
Me personally, no, because I'm not in clinical practice, but I do have contacts that may well have them. So if they want to email me directly via my email, I will then try and reach out on their behalf and see if I can get hold of some.
Brilliant. Maria, there you can see Sheri's email contact on the bottom of this, on the current slide there. So hopefully you can take a note of that and pass that on. Then I've got cloud processing sites also use vast quantities of water. So these are not just a carbon footprint issue. While digital is inevitable, it is not a complete solution, with many folk completely unaware of the environmental impacts. So again, there's mainly a comment there. Also, there's just a comment there, oat milk in the lab department fridge instead of dairy. So that's just a comment there, I think, following on from your comment on your diet choices. Is there any more questions there to come in? I think that might be it for now, Sheri. So I'd like to thank you on behalf of the BAC for presenting today. I think it's been really interesting and thought-provoking, and hopefully with all these initiatives we will start to see some changes going forward. So thank you very much.
You're more than welcome, and I apologise for that brief interruption in the middle when my laptop was about to turn off because I forgot to turn my smart plug on. Even though I plugged my computer back in. So technology is a wonderful thing. Even when you try and be green, it catches you out. So thank you.
That's great. And just to let you know, I counted, we had a maximum of 49 on the call today, on the session today. So.
Absolutely brilliant. Thank you so much for everyone attending, and feel free to connect either via social media, via my email, or via the clinical Labs Susnet site too, because if you do have any more questions, we can ask the community what they do and what their practices are, and someone might be able to answer any questions you might have, even if I can't.
That's great, thank you. And just to let those attending that this will be going up on the BAC YouTube channel, and Sheri has agreed for us to actually put our notes up on the BAC website. So that's brilliant. Thank you very much.